So now we're going to do intraoral. And as you know, I always change my gloves between intra and extraoral. Some of the things we've already looked at that are listed as the intraoral. We've already looked at the external lips, so we're not going to do that again. And now we're going to look at everything else. So first thing I'm going to say is open your mouth really wide for me. Can you stick your tongue straight out? Can you put it back in for me? Can you move it into each cheek? Okay, very good. Because I'm looking to make sure the mouth that it's moving correctly. All right, now I'm going to pull her lips out, bite together for me, please. And look to see, now our tissues are just beautiful. There's no plaque. She's class 1 occlusion. I'm going to make note of that. Her midline is lined up. Push your jaw forward as far as you can. She has no problems with movement there. And can you open for me, please? I'm going to take just a quick look. All of her teeth appear to be intact. Very nice. Very, very nice. I'm going to check the palate while I have my mirror. That looks very nice. Can you say ah for me? I'm looking at the soft palate with that. Now I'm going to feel the tissues. First thing I'm going to feel is in the parotid area. And I always like to make sure there's no lumps or bumps there and that it milks the saliva. Okay, and do the same thing in the floor of the mouth. And I do bilaterally. I always put a little pressure underneath so that I can feel if there's anything. If you just push like this, there's no resistance, so you really need to be able to do that. I'm going to have her put her tongue out for me, please, now. And I'm going to wrap the tongue. Be sure to tell your patients or they won't know what you're doing and they look at you like you're strange. And I'm going to say, holding on to the tongue, I'm going to look on each side. When I pull, you see, I can really get down underneath there. I want to see back to that whole border. Same thing on the other side. And now I'm going to have you say ah again. Ah. And it's going to see the tonsils in the back of the throat, looking at the uvula. Everything looks good. So I've looked through everything, and then this is when I make sure I look through my list, make sure everything on my list I've looked at, and I have. So I'm going to say the only thing left for you to do now is pulpal testing. I'm not going to do testing, but you will be doing an electric pulp test also. So thank you very much, Deidre, and thank you, camera woman Debbie, even though it took us a little longer.